The high cost of hospital readmissions. As the payer reimbursement model moves away from pay-per-service to value-based care, chronic care professionals and CFOs are seeing a revision of their priorities. The Center for Medicare and Medicaid Services has announced that by 2017, 90% of all Medicare payments will be value-based, which presents an enormous challenge for readmissions, defined as the return of the same patient to the hospital for the same condition within a 30-day period. How big is the problem? Nearly 20% of hospitalizations by Medicare beneficiaries are followed by readmissions within 30 days. And by one estimate, up to 90% of hospital readmissions by Medicare beneficiaries are unplanned and unnecessary, costing the nation $17 billion every year. Renal patients have the highest rate of readmission, with nearly 1/3 of kidney transplant patients being readmitted due to complications with organ rejection. For various cardiac conditions, 30% of Medicare and Medicaid patients diagnosed with congestive heart failure were readmitted within 30 days. 1/5 of patients who underwent heart valve procedures were readmitted within 30 days. And based on national averages, if you have an acute myocardial infarction, your chances of readmission are 17.8%. Whatever the condition, research indicates many circumstances can lead to hospital readmission, including complications from the initial hospital stay, such as infection from the initial surgical procedure, chronic conditions that create frequent acute events, and poorly managed post-acute care. One of which is medication noncompliance, which contributes to 11% of readmissions. Taking the wrong dosage, not taking prescribed medications, or rotating medications to accommodate multiple conditions on a limited budget. A recent study published in the Journal of General Internal Medicine found that poor communication between hospital clinicians and primary care providers often results in poor care coordination after discharge, and of course increases the chance of patient readmission. Which is why one of the key goals of chronic care management is coordinating communication from provider to patient to increase compliance and reduce readmission. Smart CCM was developed to help chronic care professionals better manage their patients and decrease acute conditions without adding cost, time, or complexity. Their solution provides the high-touch care vital to improved outcomes and decreased morbidity. Reducing readmissions is a patient-by-patient effort, but doing so will potentially save Medicare billions in expenditures and prevent millions of adverse health events. For more information, visit smartccm.com.